ॐ शङ्खं चक्रं जलौकां दधदमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृद्यां शुक परिविलसन्मौलिमम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निम्.
Thank you, dignitaries over the dais, my friend in the hall, and dear friends. For the last 2 hours, you are listening over the number of the drugs, and definitely you were in the stress or how to get rid of this session and should go to home or to the meal, something like that. But this is a transient phase of stress. Sometimes when there is acute stress and lasting for hour or 2 hours, then it gives some results. In the same way, if the stress sustained for over years, then it gives some other diseases like the lifestyle disorders, depression, mania, and all these things. So here I am related to management of stress-induced migraine with shankhapushpi and mandookparnee potentiated ashwagandha. Stress, as an introduction, sudden rise of stress may lead to the precipitation of migraine. Sustained stress over a year lead to diseases like hypertension and diabetes mellitus. Major drugs, shankhapushpi and the mandookparnee, as has been mentioned in our Ayurveda test, have the effect to modify the stress response of the body. These drugs may work as adaptogenic drugs against the stress. So here I have selected the double-blind control study to evaluate the anti-stress activity of the shankhapushpi and mandookparnee potentiated ashwagandha on the stress-induced migraine, especially stress-induced migraine. Now the drug, this drug that I have told before, I was used, and the preparation of the drug, 100 gram of the ashwagandha churna triturated with the 10 milligram of the shankhapushpi and 10 milligram of the milliliter of the mandookparnee shoras, and it was made right in the shade, and this process was repeated for 3 times. Placebo, and the drug was given in the group A, while the placebo, that was the sugar of milk or lactose, was given to the group B in the dose of 250 milligram twice a day. Ashwagandha churna was given in the 3 grams per day, and this was the pre-migraine days or in the buffer days. While during the migraine days, the episode of the headache was terminated with the help of the Danti Pravaliyog with the Sirasula Vajras in the appropriate doses. Especially in the common doses was the Godanti was 500 milligram, Pravalpichi 200 milligram, and Sirasula Vajras 125 milligram. Method, the study included 50 patients, 25 in the group A, that is the treated group, 25 in the control group, and they were divided in such a way. 3 gram of the drug was given, as I told before, and the duration of the study was selected for the 3 months. The patients were evaluated at the interval of 15 days over the treatment period of 3 months. Inclusion criteria. The patient must be suffering with the stress-induced migraine, but be otherwise healthy. He should not suffering from other disease like. He must have experienced at least 5 to 6 episodes of such headache. This is a very important thing because number of times the patient himself is not knowing whether he is suffering from the stress-induced migraine or not, or he is not saying my migraine or this is my migraine headache is going to precipitate. So this is very important so that I could understand him better. And he must be able to identify the pre-migraine and migraine phase. Exclusion criteria: uncooperative and irregular visiting patients. He should not be suffering with any other chronic disease like the diabetes mellitus, hypertension, tuberculosis, and the depression and the anxiety neurosis. If he is getting the treatment from elsewhere or he is drug resistant, he has been excluded from this criteria. Assessment parameter, very simple, very clinical. The Singh personal stress score inventory to evaluate the level of stress in an individual. This was done in the pre-migraine phase. and in the migraine phase and in the buffer days. But after a few months of the study, it was decided that during the migraine phase, this personal store, zinc personal store inventory is not working, because the patient is so irritable in this phase that we have to give it up. Visual analog scale, that is on 1 to 10 score for the pain assessment. Similar visual analog scale for the sleep assessment, change in the duration of migraine days, and other symptoms like the improvement of the concentration of work, associated nausea and vomiting. Greater emphasis was given to the points: assessment of stress on zinc personal stress score inventory periodically during the pre-migraine days and buffer days, assessment of pain on visual analog scale, assessment of quality of sleep, assessment of the duration of migraine, and in the associated symptoms. Observation that I found: this is the table showing the number of patients divided in the age groups. And now the stress, mean stress I have shown in the table form. The maximum in the pre-treatment you are seeing 79.80 on the, this was the mean stress, 77.17 in the second group and 74.00 in the third group. And after the post-treatment, if you see, there is a marked reduction in the stress, that is in the first group, age group, is the 38.8, 38.17 and 31.5. Very similarly, the results are found in the female also, from 78.5 to 39.6, 76.75 to it has been reduced to the 35.25, 75.5 it has been reduced to 37. But on the contrary, in the placebo group or control group, the reduction is very minimal. And as the table is showing, 70.67 it is just reduced to the 65.00, 75.75 it has been reduced just to the 67.5, and in the male 77.5 it has just reduced 63.5. The very similar result has been found in the female also. Pain assessment in the migraine days at the visual analog scale, there is a marked reduction in the pain. This is your pre-treatment age 6.8, and it has been reduced to the 3.8, and in the second age group, 30 to 40 age group, 77.17 it has reduced to the 4.67, and from the last of the 40 to 50 age group it is just reduced from 7.00 to 4.00. The very similar results also obtained from the females also, but you are seeing in the control group the results are not minimized on this visual analog scale. 7.1 it is just reduced to 6.1, 6.5, 6.75 it just reduced to 5.75, 7.5 to 6, and in the female 7.33 to 6.33, 7.2 to 5.8 and 6.5 to 5.5. It is showing there is not a much reduction in the control group. Sleep quality in the pre-treatment 6.32 it has been improved up to 8.2, 5.1 it has been improved to 7.9, and from 3.5 it has been reduced, increased up to 6.8. In the control group 6.4 it has been raised up to the 7.4, and from 5.2 to 6.9 and 3.5 to 3.5. There is no change in the 40 to 50 age group. This is showing there is a slight improvement in the sleep quality or in the control group also, and we will discuss how. And the improvement of the symptom in the stress in the pre-migraine days, 96% of the patient improved while 4% doesn't. That is one patient. And the pain intensity, 21% got relief out of 25, but 4% have no significant response. Pain duration, 17% out of 25 get relief, and 8% have no response or the minimal response. Extension of the buffer day, this is a very important finding. 96% of the patient or the 24 out of 25 patient has increased the duration of the buffer days. Buffer days means the period in between the two migraine headache. And there is no change in the 22% that has been in the control group. Sleep quality is improved, in almost all the group, but this is markedly improved in the treated group. Concentration to work improved in the 72%, while it is just improved 32% in the control group. And the results, stress during the pre-migraine is reduced significantly in the treated group from 96%. And there was only one patient who did not respond to treatment in the group A. The reverse has been observed in the control group, in which 68%, the 17 out of 25 patients got the relief, while 8 out of 25 patients has responded well in the control group. Pain intensity, that is very much significantly improved in the this treated group, while it has not been increased in the control group. Sleep quality is observed. 22% treated group, they got benefited, while it was just 48% in the control group. Concentration to the work was also improved significantly in the treated group. So, if you want to draw the conclusion, the selected drug ashwagandha powder potentiated with the shankhapushpi and mandookparnee effectively control the stress among the migraine patient. It also prevents the precipitation of the migraine induced due to stress, definitely due to stress. Thus, the drug is helpful in the management of migraine. The effect of drug may be attributed to its constituent. In future, the drug may be helpful in the management of other stress-induced diseases. Thank you very much.